Assalamualaikum. Today we will present about drug-induced hepatotoxicity. This is our group members: Umi Umairah binti Muhammad Nazrin, Nur Hanum Hamira binti Hairudin, Nur Atikah binti Muhammad, Putri Ayu Aisyah binti Nur Safwan, Aina Farzana binti Abdul Rafiq, and Nur Sofia binti Salihat.
The first drug is amiodarone. Amiodarone has several mechanisms of action. The classification system imperfectly classifies the medication as class 3 arterectomy because of its predominant potassium channel blocker that increase the cardiac action, potential duration. Amiodarone inhibit potential efflux through rapid delay rectifier channel during phase 3 of the action potential. The medication also has class 1 arteriotomic properties via inhibition of sodium channel during phase 0 of the cardiac action potential.
The second drug is chlorpromazine. Mechanism of action of this drug is the drug will probably pass through the liver. So chlorpromazine is extensively metabolized by the liver, also by the enzyme NCYP3A4 substrate. The metabolism also undergo in the kidney and the tract. The drug will be excreted in the urine by feces.
So for the next drug, flavoxamine, what is the mechanism of the action? So for the first one, that this drug acts as a restoring and maintaining the balance of the fatty acids. And then the second one, flavoxamine also acts as a strong antioxidant to limit oxidative progression. That's all.
For drug number 4 is aspirin. Mechanism of action: aspirin is a salicylated acid analgesic, anti-inflammatory and antipyretic activity. It is a selective and irreversible inhibitor of cephaloxygenase 1 enzyme, resulting in direct inhibition of the biosynthesis of prostaglandin and thromboxane from arachidonic acid. Additionally, it also inhibits fat degradation metabolized in the liver into salicylic acid, salicylic phenolic glucuronide, glycolic acid, and glyceric acid.
As the phenytoin, the mechanism of action is phenytoin is an anticonvulsant which elevates the seizure, threshold the motor cortex by limiting the post-tetanic potential (PTP) of synaptic transmission. It exerts this effect by preventing the excessive accumulation or intracellular sodium, the passive influx of sodium, or decreasing the efficiency of the sodium pump.
Treatment of DILI. For the first treatment is early drug withdrawal. If this treatment is done early, it will result in recovery. And if patients have hepatocellular jaundice and impaired liver function, consultation with specialist is indicated because liver transplantation may be required. So for the antidote for DILI are available only for hepatotoxin, include an acetylcysteine and penicillin. For an acetylcysteine is acetaminophen toxicity and silymarin. For penicillin is Amanita phalloides toxicity.
Second, for the DILI treatment, it is to prevent special cells in blood from sticking to each other, to reduce the risk of harmful blood clots forming in the body. Blood clots that form in the blood vessel inside the heart or brain can cause a heart attack or stroke. It helps to lower the chances of heart attack and stroke to those who are high risk. May use to stroke those who are high risk.
Okay, for the treatment number 3, it is a liver transplantation. The liver transplantation, it may be necessary when their life fails due to disease or injury. Most commonly, doctor will consider a liver transplant to treat rare disorders such as DD or urea cycle.